and welcome to Let's Talk HR with Dr. Deneen, the talk show that spotlights HR professionals and talks about all things HR. Today, we will continue our series on Let's Talk HR with Dr. Deneen called Careers That Rock. Oftentimes, HR professionals are instrumental in helping people find sustainable careers and finding their niche in the world of work. The series highlights amazing professionals and provides insight to those who may be interested in pursuing a career that rocks for them. I am delighted to introduce the sixth guest of the Careers That Rock series. She is none other than Dr. Cyrilyn Walters, Doctor of Internal Medicine and Pediatrics, and the Medical Director of Ambulatory Services, Regional 1 Medical Center in Memphis, Tennessee. How are you doing today, Dr. Cyrilyn?
I am wonderful.
Oh, good. So glad that you came on the show today in order for us to learn what medical doctors do and for people to learn more about how to get into that profession. So it's a great topic because we know doctors, right? We know doctors.
Yes.
We go to doctors, but we need to find out how to become a doctor, and that's what we'll learn today. So you have been trained in internal medicine and pediatrics. You are an academic physician as well. And you currently serve as the Medical Director of Ambulatory Services at Regional 1 Medical Center. Did you always know you wanted to go into medicine, or tell us about your career journey?
I actually thought that I was going to be a teacher. Both of my parents were teachers, and I knew I really liked kids. And I was in high school and was certain that I was not going into science. And so my mom urged me to kind of have a broader perspective.
Yeah.
And we started doing life sciences and biology, and I fell in love. And so the only thing that I can think of where you can use that skill was to become a doctor. So I decided that was going to be my trajectory, and that's essentially what I did.
And that's what she did. She fell in love with biology.
Yes.
And that's a good subject or topic to fall in love with.
Yes.
And so a doctor is what you can do with biology. So glad to hear that. So I know there are many different types of medical doctors, physicians. Yes. What are some of the common types of medical doctors?
And so you traditionally would see your regular doctor, which can be your general practitioner. They can either be internal medicine doctors, pediatricians for kids, family medicine, your obstetricians, gynecologists. Those are the ones that people mostly interact with. But if you had to go to the hospital, that's when you have your surgeons. Your emergency department doctors and your hospitalists or ICU doctors that take care of you when you're very sick.
So let me ask you this, Dr. Cyrilyn. Is working in a hospital the only setting that doctors practice in?
No, we're everywhere.
You're everywhere, man.
So academics, you can be in the teaching field. So where you train, the same medical students and residents. You can work in a clinic or a private setting. We have doctors that still come to people's houses and offices and take care of them. You can work for an insurance company or a pharmaceutical company as a consultant. You can be a scientist that do research. You can work in the military and take care of or veterans or active military soldiers. There is pretty much every area. There is a physician in the White House.
Yes.
Someone has to take care of or executives in the White House. And so in every area that you may want to, you can find a medical doctor, whether in a consultancy role or in an actual practice role.
Wow. So you are an internal medicine doctor and a pediatrician.
Yes.
That's an interesting combination. How did you come up with that combination?
I basically stumbled on it during my training as well. I went in, I already said I had an interest in kids, so I went in thinking I was going to be a pediatrician, and specifically with babies. I wanted to be a NICU doctor. And while I was training in the adult experience that you do through your medical school training, I met these doctors that were trained in both. And I was like, what is this internal medicine pediatrics? And they call it med peds. And so I was like, what is this med-ped specialty? And basically you combine being an internal medicine doctor with a pediatrician, and you kind of skip a year. So instead, each one of them you require 3 years, which would be 6, and you can do that combination with 4. And so we were able, I just realized that I actually liked adults as well. And so as a result, I decided to do the combination.
Absolutely. That's wonderful. Med-Peds, right?
Med-Peds.
Internal medicine and pediatrics, all in one.
Yep.
I'm telling you, we're learning today. We are learning today. So if someone was interested in becoming a physician, a medical doctor, and they just don't know where to start, how do they get into that, and what are some of the major steps that they would need to take to get into that profession?
So being a physician or a doctor is a professional degree. So you have to start off with your undergraduate or bachelor's degrees overall. And this would require you going to 4 years of college. There are some programs within the US and other places that can have combined degrees. So instead of spending your 4 years getting your undergraduate education, you can combine that with your professional medical doctorate degree. So after those 4 years, then you apply to medical school, which is another 4 years. And so overall, you're already starting with about 8 years of education that you have. And that's where you get your introduction into the medical sciences. You experience what it means to be a doctor on every day. And then once you're finished with that, then you decide what kind of doctor do you want to be. Do you want to be a surgeon? Do you want to be an internist? Do you want to be a pediatrician? Do you want to be a gynecologist? And based on that, it's called residency, but it's basically on-the-job training. And so you do get a paycheck at this point, but you're not a full-fledged specialist until you go through those trainings or residency practices. And those can be anywhere. The shortest is about 3 years to be a family practice doctor or internal medicine or pediatrician. And they can go anywhere to 6 or 7 years, depending on what type of surgery you want to be. If you want to be a neurosurgeon, it's going to take you a while. You don't want anyone who doesn't have a lot of experience tinkering in your brain or your spine.
You don't.
So it depends on which specialty you're going in. That can be, and then further after that, you can do what's called a fellowship, which is even going into more of a niche. So if you're an internal medicine doctor and now you want to be a cardiologist, you do your 3 years of internal medicine and then your 2 years or 3 years or however much of cardiology to become a cardiologist. So it's a lot of steps and a lot of levels, but honestly, the person that is responsible for your health and life, you want them to have as much experience as possible before they come and take care of you.
Absolutely. Please. So the baseline is 8.
Yes.
And then according to your specialty, you add on to that.
Correct.
Wow. That is so interesting. So you know it. You know what to do. You know your first steps, committing that 8. Now, I know for a physician, for a doctor, there is probably a lot of rigor going on throughout the day. So tell us about the typical day in the life of a medical doctor.
And I would say one of the things I love about being a medical doctor is that it is a profession where there's so many different opportunities. So I will tell you, my typical day is I work in the clinic currently, and then I have some administrative roles, including the medical director. So I may come in to work at 7 or 8, depending on when my first patient is, see patients, and throughout the day, I'm juggling seeing patients and having meetings, and then I'm usually finished by 5 in the afternoon. In my previous life, like I've been around a long time, so I worked inside the hospital, and during that, my schedule was a lot different. It was 12-hour shifts that I would do, 2 weeks on, and then I would get 2 weeks vacation.
Oh, wow.
Well, and it's not vacation, you're still working, but because you work those 12 hours and they're pretty hectic and you're doing it for 14 days, then you kind of get that break. If you're a surgeon, you might come in at 5 o'clock in the morning and have your surgery and be done by 3, and then do paperwork or have clinic. And so there's such a wide gamut of what your day can look like once you do become a physician. And it also depends on academics versus private practice. You can really structure your day how you're wanting. If you're a shift worker, you might want to go into emergency department or something that has shifts. If you say, hey, I don't want to talk to people, you might become a pathologist or a radiologist, and you're in a room reading x-rays and CAT scans and slides every day. So it really depends. Like, you have that opportunity to change your day however you feel is suited for you.
Yeah. So you do have some flexibility in your day, and you can plan your day.
Correct.
But it is a lot of work going on in that one day. From what you explained. So how many hours would you say you put in
currently? Right now I probably do 40 to 60 hours. Before, I would do 80 when I was working in the hospitals. During residency, which is that training, like on the job training, you can do 80, sometimes to 100, depending on how much you invest in your time, because this is also a career where you're ever learning. So you might see a patient right now and you have to go and do research because there's a symptom that just doesn't coordinate with what you're thinking is going on, and you need to figure it out. So you have to have that curiosity. And sometimes that requires you to do extra work after work.
I see. Extra work after work, right?
Yes.
Lifelong learners. You just don't learn and then stop, right?
Correct.
So it's continuous.
Correct.
Continuous research, staying on top and abreast of new developments, all of those things, all wrapped into one.
Correct.
So with all of that going on every day, all those hours, do you ever have any other personal hobbies?
You have
that
to.
You do.
You have to. You absolutely do not want to drown in your career. So you want to have hobbies. For me, I like event planning. So I actually have an event planning business on the side. So I plan parties and dinners and different things, and that's my creative outlet. I spend a lot of time with like my dogs and my family. I love to travel. I say I work to travel, not work to eat. So I like traveling, and so that those are my escapes.
Yeah. Okay. Wow. So you're a doctor, you travel, you plan parties. Do you sleep at all? I don't know.
I get my sleep. That is one thing. I will make up my sleep deficit. I am one of those.
Yeah, okay. So in juggling all those things, you must have organizational skills. So in the medical profession, there are certain competencies, I'm sure, that goes along with being a medical doctor. What would you say some of those competencies are, the major competencies a person should have if they pursue a profession?
I definitely think you have to have a high level of curiosity. Like we spoke about before, you have to be able to, go that extra mile for your patients, because you're going to find areas where you don't know everything. As much as we learn in medical school, we're not going to remember everything. And so you want to have that curiosity. You also have to be a very big advocate. Advocate for your patients, advocate for your coworkers, advocate for yourself, because a lot of times, the medical care gets into the shuffle or get lost in the career of medicine or the business of medicine. And sometimes you have to be that person who's going to be assertive and speak up and says, no, I don't want that to happen, or yes, I do want this to happen on behalf of what your job is. You definitely have, like I said, you're a lifelong learner.
Yes.
You're required to do this continuing education. And so if that is going to be a burden where you just want to go to work and shut off, it's not going to happen as a medical doctor. And, just being compassionate, having that interest, being a go-getter. Those are definitely, competencies. We have a governing body for our residency programs, and they actually have 6 competencies that they judge, your on-the-job training part of things, as well as the programs included in it, making sure you have medical knowledge. So you're always studying, you're always learning. Your patient patient care ability. So how well you can interact, the bedside manner that people talk about.
Yes.
It goes such a long way beside having the knowledge. System-based and practice-based learning, that's really in making sure that you have that advocacy, that you're looking at how all the different players come apart in healthcare and medical doctors, and interpersonal and communication skills. Because you have to be able to interact with your coworkers. This is a team sport.
Yes.
And so you have to be able to interact with the nurse that's taking care of your patient, or the administrator that says, you need to see 5 more patients that day in order to make budget. And so there's a lot of parts and complexities to it, and you have to have that personality, that lens, to be able to pull all of those parts together and kind of make a whole.
Wow. That is outstanding. All of the things that you have to be responsible for, and the competencies you must use each day in order to be successful in the career. Well, you talked about being an advocate, and this I know firsthand. I know it firsthand, and I want to kind of transition now to talk about the tremendous role that you played during the COVID pandemic. I know it firsthand because you were instrumental in the success of my husband's recovery from a devastating bout with COVID-19 on the onset in 2020, where he was on life support 42 days, had open heart surgery because of COVID, spent a total of 100 days in the hospital. You were there every step of the way, and being an advocate is so true. Keeping us updated on COVID information, offering community education, all of those things. What motivated you to go the extra mile to help others during this time?
I think my motto in life is to treat everyone as I would want to be treated.
Yes.
And for me, that has a big space in justice and equity for all.
Okay.
And so when I know that I'm in a position that I may be able to help, and basically what happened with COVID is it fell in all of our laps.
Yes.
And I was in the space where I was the medical director, and all the healthcare, this was not planned. So we were trying to, lay the tracks while the train was going.
Yes.
And so we're trying to figure out, hey, what do we do? What is needed? And I was on that line where you saw patients come in and you saw things happening. And I said, okay, how could I help? How can I be of assistance to everyone? How can I ensure that, we're getting the things that we needed? And I saw that there was that space where people were afraid because they didn't know what was going on.
Yes.
Unfortunately, some of this was politicized because it was a political year.
Yes.
And wanting to try to separate that and ensure that people got what they needed, were in the spaces that they needed. So if I had knowledge being on the front line and someone else needed that, I wanted to share it. And so that was basically what got me. And I'll do it for anything. COVID is not my specialty, but I kind of fell into it, and it became the specialist at the hospital because I just had that need to help others. And when we look at it, ultimately too, it, for the disenfranchised population, it affected them mostly. And I'm a big proponent of health equity. And so it was something that's kind of just tugged at me that I needed to do this for my community.
Yeah. So you were a wonderful advocate, and you're so right. It's something like we've never seen before, right? Just by breathing, you could contract the virus or the disease. And it's something the medical field had never seen before either, right? So how did doctors and hospitals handle the outcomes, these devastating outcomes in real time of the virus?
It was hard. And when you talk about working after work, this was one of those situations because you could not say, okay, I had the tincture of time to figure this out. We had to come together, put aside everything else, and literally we would have strategic meetings every day or every other day. What do we need? This is the information that we're getting. How do we get our PPE? How do we keep our community safe while taking care of our patients? And there are some things that, in hindsight, we can look back and say, well, maybe we should have done this better. But we had this pandemic happening, and we had to take care of everyone. And as a result, we just put everything aside. Everyone, even pay cuts happened.
Oh, really?
Yeah, in order for us to get together and work and make sure that we're providing the care but keeping people safe.
Yes.
So that included, not being able to do
Mhm.
surgeries
Mhm.
right away that were
Mhm.
elective, and having space for COVID patients to come in. And so it did require every single person, from the cleaning to the finance to the medical doctors, to everyone coming together and saying, hey, if we need a doctor on the hospital side, I know you're not used to it, but are you there as needed in an emergency situation if we don't have enough doctors to care for our patients? So it from the top down, all the way bottom, all the way up, it
Yes.
was, and it was hard.
Yes.
It was definitely hard. People saw a lot more loss. Doctors and healthcare professionals are humans. And so it's, going home and crying because you lost 3 or 4 patients that day from COVID, and not being able to provide as much. So it was hard, but we had to do it. This was the profession, and this is part of it. You had to do it. You couldn't say I quit today,
right?
Just because it's hard. You just had to be able to deal with it.
Wow. So it was a collaborative effort.
Very much so.
Everybody playing a part to try to make this work of this unknown virus that we had come across. And so that is such interesting information to know, but it feels good to know that everybody stepped up.
Yes.
Doctors, hospitals, even pay cuts in order for people to do better.
Yes.
Yeah. So that is awesome. So are we out of the woods yet? Because I know it's a new variant that's emerging. Are we out of the woods yet?
I wouldn't say we're out of the woods, but we're definitely not at the pandemic level where we don't know what we're dealing with anymore.
Yes.
I think, within the last 3 years, we've done a lot of different things. One, we've instituted protocols, so now that if a pandemic or something to that nature or that level we have steps that we're not trying to make up. So, and in addition, we have vaccines, we have more research, we have more medications, we have more immunity in our population overall. So we're having all these emergent variants that, that virus is smart. It doesn't want to die. It wants to live on. So it's going to mutate, and it's going to have different variants. And now that we know that this is, a health concern, we have so many people at the cutting edge looking and making sure that when this happens, we have all the things that we need in our arsenal so that we don't get to that pandemic level again. So not out of the woods, we still need to, make sure that we when we have symptoms, we get tested, that we, personal hygiene, we're keeping your hands clean, wearing a mask, staying away from persons when you're ill. And that's something we didn't do. Yeah. Because you had the cold and you still went to work, and you still coughed, or you had the fever and you're like, oh, I'll be fine. Yeah. But those were just as contagious as COVID was. It's just that, the other person got it and no one knew.
Right.
And so, it's another thing with, healthcare, when, if you're sick, you probably should go home.
You should go home. Yes.
Home and take care that you're, not passing viruses on to other people.
I understand.
Yeah.
And thank you so much for that, giving us some steps in which to keep that going. So there's a new vaccine, right?
Yes, so the vaccines are being updated for the different variants that are causing more of the illness. And so we've gone through so many permutations of this virus since it came out. And so the vaccine last year started where it had combination with 2. And so now the newer one is going to have an updated version of the different variants so that you're more protected and not have serious complications as a result of catching COVID.
Okay. So what do you make of, is this something we're going to have to do every year, you think? What do you make of that?
I think it is. I think it's going to be like influenza. We have the flu. Most people never think about the flu, but when you're working in a pediatric hospital or a hospital with older people, there are people that die every year from the flu. And it's usually the ones that have the lowest lowest immune system, so our kids and our elderly population. I think COVID is going to get some semblance of that, where just like the winter time, we have all these viruses that come out, or even at the end of the summer. I think for the last 3 years, we've had a bump in cases in the summer, actually.
Oh, okay.
And so having these bumps every once in a while, having some people get really sick and end up in the hospital, but for the majority of healthy people that, doing the things that we just discussed and, having some immunity, it keeps you from getting severely ill.
Yes. So you heard it right here. You know what to do. You know exactly what to do to keep yourself safe with this emerging COVID variant that's upon us. So, oh my goodness, this has been such a wonderful conversation, but I do have one last question for you. What advice would you give someone who's aspiring to become a medical doctor?
It's a marathon. It's definitely not a race. It's not a profession that hey, I just want this notoriety, because there are times that it's not. Really know what you're wanting to do. And a lot of people, when the admission process, people spend their time, okay, I need to check this box and check these things in order to get into medical school, because it can be competitive. But really and truly what they look for is someone who has a heart to want to be in this profession. So you have to do your prerequisites in your science classes to get into medical school and those requirements, but take that time to kind of learn yourself as well. Because undergrad, you're usually on the younger side. Take that English class or the photography minor if you want to, or that Spanish minor. Travel for a year if you want to, because it makes you a whole person. And becoming a medical doctor is more than just the knowledge. As you can see, the competencies that we spoke about is a lot more than just the knowledge. You want to be able to connect with patients. You want people to trust what you say. You want to have that humbleness to know that you don't know everything and you never will. It's just way too much information. So I definitely say have a heart for wanting to do it. Don't do it because it seems prestigious or there seems to be a lot of money. There is so many ways to make more money without spending so much time in school that you are going to be in for a rude awakening if that's the reason that you're going into medicine. So be humble, experience life, and if this is the thing that you want to do, then we would love to have you in our profession.
That is wonderful. You heard it here. It's not just always knowledge, but it's always heart.
Yes.
It's always connected to the heart. Thank you so much for coming today. This has been an amazing show learning about the medical profession, and thank you so much for coming. Wow, we have learned so much about the career and profession of physicians, medical doctors, with my guest, Dr. Cyrilyn Walters, Doctor of Internal Medicine and Pediatrics, and the Medical Director of Ambulatory Services at Regional One Medical Center in Memphis, Tennessee. An amazing profession. Being formed and aware of possibilities of different careers, it's paramount. HR professionals can be the resource to help educate and guide you to the career and the profession that rocks for you. Be sure to watch new episodes of Let's Talk HR with Dr. Deneen, the first of every month on the YouTube channel of the same name, and on Comcast Xfinity, Channel 17, that's 1091, Monday nights, 8 p.m. till 8:30 p.m. Please note, you can watch Let's Talk HR with Dr. Deneen and prior episodes at any time. Go to the YouTube channel and type in the talk show title. Be sure to subscribe at no fee and click on the notification bell. This is HR TV. I'm Dr. Deneen, and I want to talk HR with you. HR forever. See you next time.